Welcome. It is Friday, May 1st. We are hosting our Friday knee replacement Q&A. So what does that mean? It means that Dr. Sinha, my husband Raj, and I, Diana Braun, are here. We are the ones who wrote Knee Replacement Secrets, and we do our best to go live on most Fridays for you to be able to ask questions you have about knee replacement, whether you're preparing, avoiding, or maybe you're in the middle of it right now. Maybe you are trying to recover and you cannot sleep. You cannot get comfortable. You are swelling. You thought, I had this 2 weeks ago. I thought I'd be like running a marathon by now. What's going wrong? So we're here to answer all of your questions. I had bilateral knee replacement myself 2.5 years ago. So I try to post a video every single day on Instagram and Facebook to help educate you on what you can expect, give you tips and tricks, and that's really why we show up here every week. So Lazy Jane's getting ready for her next knee replacement in, I think it said July. Preparing for knee replacement is so important. So I have like a whole chapter in the book, Knee Replacement Secrets, on this, because setting yourself up for success, so important. So I'm going to assume, Lazy Jane, you're going to have the same doctor or surgeon that already did your first knee. So you've already did the homework to find an excellent qualified surgeon. First, like that is, for any of you thinking about it, that is the most important thing. You need to find the most qualified surgeon that you can. What does qualified mean? What would you recommend the number of surgeries, knee replacement surgeries, that surgeon does for you to feel confident that you're getting a well-qualified surgeon?
So absolute bare minimum is 50 knee replacements per year. That's there's been studies on competence and master level and stuff like that. So competence is at 50. If they're doing fewer than 50 a year,
that's not the surgeon for you.
Yeah, probably not.
And
ideally
then,
200 plus.
Yeah.
200 knee replacements, not 200 surgeries.
Yeah.
200 knee replacements per year.
Yes.
Is sort of getting into that really good approaching master level. 400 per year and above is master level.
Yeah. And let's not confuse how long they've been a surgeon with specifically how many knee replacements they do. And don't be afraid to ask these questions. It's okay. So we're going to assume, Lazy Jane, you're using the same well-qualified surgeon you did last time. And then really working on, there's a couple things. So the mental part of it, I like to talk about as a high-performance coach. Knee replacement's really hard. You've already gone through one. You need to have a list of things you're looking forward to doing as you recover, because there's going to be dark days. This is a hard surgery. So you need to remind yourself, like, hey, start making that list now. You're also going to need a list of things to do when you have downtime. We can't just binge on Netflix all day, people. It's a great time to organize the photos on your phone or do scrapbooking or anything that's like a lap activity while you are elevating that leg, or at least, toes to your heart, or even better, nose while you're icing. That's going to be important. Have that list. And then because you have just had another knee replacement for you, I'm going to recommend that you make sure you have a toilet riser that has 2 handles on each side so you can push up and down. Your other quad is not back to 100% strength yet, and we don't want you to have a tumble or a fall. So make sure you get an elevated toilet seat that has 2 handles on it that you can push off of, and then you're going to want to have that walker closer. It's your similar situation like having bilateral when I did both at the same time. For you is going to be really important. And be very conscientious of the fact that your other quad has not come back yet 100%. So you're going to need to be very, very careful about movement around when you're doing one so close to the other. And you'll do great because you've already gone through it once. So I hope that helps you. And again, knee replacement secrets, whole chapter in the book. Obviously staying hydrated, eating healthy, high proteins, healthy foods, not drinking, no smoking, all those bad. If it's bad for you, don't do it. Pretty simple. All right, everybody, have a great weekend. We're glad you came.
Have a great weekend, everybody.
All right, bye.